All across Canada, patients and doctors are asking for change.
Doctors would know my name, not just my symptoms.
They would understand our culture.
We would be empowered to treat patients and teach students.
To leverage AI so we can improve our quality of care.
Through a bold new approach to medical education, the Toronto Metropolitan University School of Medicine is creating that change.
Attention hospital HR in Canada, are you in search of the perfect insurance solution for your part-time and casual employees? Look no further. Meet Healthcare Providers Group Insurance Plan, your go-to option for ensuring the well-being of your team.
With healthcare providers, also known as HCP, you're not just providing insurance, you're providing peace of mind. HCP's comprehensive coverage includes medical, dental, and vision benefits designed to keep your part-time employees happy and healthy. There's even a package that includes life, long-term disability, and accidental death, disease, and dismemberment coverage for those who already have other group health and dental coverage.
It's time to bridge the gap between full-time and part-time staff benefits. With Healthcare Providers Group Insurance Plan, you can level the playing field and show your commitment to all of your team members.
Join the community of over 145 hospital sites who have made the smart choice. Visit healthcareproviders.ca today to discover how HCP can help you support your team in a meaningful way.
Is this thing on?
I think they can hear us a bit better now. Do you think they are ready to change the status quo?
It's one thing to get them listening, but now let's get them to act.
You are now about to witness the strength of nursing knowledge.
Welcome to the Gritty Nurse Podcast, an unfiltered discussion on health and healthcare. My name is Sarah Fung.
My name is Amie Archibald-Varley, and we are your hosts. Our Toronto Star and the Globe and Mail national best-selling book is available now. Get your copy of The Wisdom of Nurses today. You can get a book for purchase at any of your local retailers like Indigo or Chapters, or pick up your book online through Amazon or other types of retailers. It's also available in various different formats like audiobook and on Kindle. If you read it and you loved it, please leave us a review.
Please make sure you subscribe on our YouTube channel where you can watch our podcast in video format. Like, share, and leave a review. If you're listening on Apple Podcasts, Spotify, iHeartRadio, or any other podcast platform, leave us a rating and review. Thank you to all our listeners and sponsors who continue to support us.
Your support makes our podcast possible, and we're grateful for the partnership and for you believing in our work here at the Gritty Nurse Podcast. Stay gritty.
Hello, everyone, and welcome to the Gritty Nurse Podcast. My name is Sarah.
And my name is Amie.
And we are your podcast hosts. As you'll notice, we have something on our faces today. If you are listening on audio, you won't know, but we have mustaches on our faces.
There's no way. No, you look normal. Isn't this how we look every day when we do our podcast episodes?
It is. Totally is. It's the month of Movember, and we wanted to do an episode on men's health.
Yeah.
Okay.
So I thought it would be important for us to, show our support wearing our mustaches to talk about Movember. And again, it's actually, that's my mustache. Oh my God. I am totally not serious. I can't handle this. Okay. Anyway, so we are here to talk to you about Movember. It's the month of November. But even before we talk about some of the stats in terms of prostate cancer, our episode is actually going to focus on, just men's health in general. And then I'm talking about our husbands' experiences with men's health, because again, it's a treat for us women to watch our men when they're sick, because they tend to be sicker than we are when we get the same types of issues. But again, we're going to talk about a variety of different things, again, focusing on the fact that prostate health is health, and make sure that you get your prostate checked. But without further ado, I think we should jump into our men's health stories. And
well, do you want to do some stats first? I thought maybe we could start with some surprising stats.
Okay. Let's talk about some stats.
All right. So did you know, Amie, that on average, men live 5 years less than women globally? Does that surprise you?
No.
All right. Next one, high rates of suicide. Men are nearly 4 times more likely to die by suicide than women.
That's not surprising.
That is a very sobering stat. Heart disease is the leading cause of death. So about 1 in every 4 male deaths in the US alone is due to heart disease.
That's not surprising either.
This does not surprise me at all. Anybody who has a man in their life will know this. Low rates of doctor visits.
That's very true. It's like trying to get our husbands out the front door. It's like, or they bump themselves. They're like, yeah, no, it's fine. I'm not going to go to get this checked. And we're like, why not? So that doesn't surprise me either.
So here it says men are 24% less likely than women to have visited a doctor within the past year, even though they have higher rates of serious health issues. And about 60% of men only go to the doctor when they believe they have a serious medical condition.
Yeah, usually when it's like,
when they're
debilitating and crippling them in some particular way. Yeah, absolutely.
Like, I think a lot of times women are the ones that make the men's appointments and then just are like, literally, okay, go to the doctor at this time.
Yeah, it's that whole caregiving role aspect where we're just like, we're taking care of everyone else. So that's a part of it, right? We're like forcing our spouses or partners or whomever to be like, you need to look after this. You need to look at this. And they're kind of like, it's not that big of a deal. Well, we're stressing out about it.
Well, here's another thing. And I don't quote me on this, but I thought I read somewhere that for older couples that are married, men and women, like I'm talking about a heterosexual couple, if they're married and they live to an old age, men live longer when they have a woman in their lives to look after them, right? Wow. And it actually can shorten a woman's life being married.
That is
when
not
you're
a shocking statistic. Oh my God.
I know.
That's crazy,
well, that makes sense. Like my grandma that lived to 107. So my grandpa actually died in his 70s.
Right.
And my grandma lived like over 30 years after he passed away. I think part of it is because she didn't have to look after anyone.
Damn.
I know.
Well, I mean, if we think about the stress that sometimes our partners can bring upon our lives, I think again, like it's that caregiving aspect where we're still like, we have our jobs, we work, and then we come home and we work some more. I mean, it's not always the case, but I think it's just that it is an additional burden. And sometimes, no, I shouldn't say burden. It is an additional unfortunate societal expectation that we take on these roles as well. And again, we need to be looked after too. So I think that, at the end of the day, I guess what I'm trying to say is, yes, you can care for your spouse, your loved one, whoever you're in a relationship with, but also make sure that you take care of yourself. But today we're focusing on men.
Right.
So actually, let's talk a little bit more, some more stats, and then we'll jump into the episode about our husbands and how they, neglect their health. So with it being Movember, we want to talk a little bit about prostate cancer. And again, I'm taking this from Men's Health, and they have a great website in terms of talking about, knowing your risk related to prostate cancer. So it says, we all have men in our lives that love to talk. They like to talk about the good old days, about that never-ending backyard project any year now, right? About something that drives them nuts. Yet some things they don't talk about enough, and that's prostate cancer. So we need to talk about the risks. It is the most common form of cancer in men over 45 years. But what's even, another story that I do have, and maybe we'll talk about this later, is a friend of mine who was like 41 who died of prostate cancer, which was wild when I found out about it. There is some good news. As long as you actually do some preventative measures, you can actually take proactive action against not having, more serious effects related to prostate cancer, because early detection is key. So that means understanding your risk related to prostate cancer, and it means knowing when to start conversations with your doctor. It also means when the timing is right, not hesitating to get that work done and to get checked out. So if you're over 50, definitely should get it. Again, if you are Black or have an African ancestry, that also puts you at risk. And then any type of family history of prostate cancer puts you at greater risk as well. And yes, we could talk about the test and what it entails. And I really think at the end of the day, it's not that big of a deal. Yes, your prostate is located in your anus gland, in your bum. So again, with a test like this, they do have to go in there and take a look. I don't think it's really that big of a deal. I'm sorry.
Okay, I agree. I agree. And I think it's just normalizing the conversation. So I don't know about you and me, but I've never been in a room where two men are talking about their prostates or the fact that they should go for an exam.
We as women will talk about her body parts all day long.
But I mean, like just to give you the flip side, right? So in our neck of the woods, breast screening has been now lowered to age 40. And I can't tell you the number of conversations, both online or in person, I've seen about this, right? Like my girlfriends are messaging me saying, hey, like when you turn 40, make sure you get your exam. And I feel like it's more normalized to talk about it. And, like for all the men out there who don't know what a mammogram involves, it is also not comfortable. I mean, your breast is getting squished in between two pieces of metal or whatever. And it's not comfortable either, but we do it. And so I think really it's just about normalizing these conversations.
Yeah. So again, there's the screening test, which is the PSA, which is like a blood test. Then there's the actual physical exam. But again, these things take like seconds to do. So make sure that you go and get your prostate checked.
Absolutely. So you actually took the next one from me. I'm glad. Another one I wanted to mention is we talk a lot about in nursing and in healthcare, the occupational hazards, right? So the physical abuse, the mental abuse, what we go through. Men actually account for 93% of workplace fatalities. And this is because they a lot of times work in high risk jobs such as construction, mining, and fishing. I read recently that tree loggers are one of the most dangerous professions in the world. And most of those are men.
Destination.
I mean, yeah, I was traumatized by that a little bit. So yeah, that makes sense. And also higher rates of substance abuse, such as alcohol and illegal drugs. I totally believe that. I actually have a friend who passed away at age 40 due to alcoholism. So I can see this being an issue as well.
So actually, what's really cool about what I was mentioning to you, Sarah, is Tom Holland. He's actually an actor. You mentioned about alcoholism, and he actually just started a new beer company. It's called Beero, but it's actually non-alcoholic beer because he talked about the importance of, recognizing that if you have alcoholism and getting it treated, and the fact that, there's still this culture around drinking, or when you're socializing to drink.
Mm-hmm.
And I guess particularly, in Hollywood and in these various different industries, you're more likely to, get involved into these things. And he's like trying to normalize the fact that it's okay to go and have a good time and also to have a non-alcoholic beverage. So I think what he's doing is quite remarkable. I saw some comments. Some people are like, that's a whole part of alcohol to get drunk. And it's like, well, let's talk about the conversation of, how alcohol can affect and how not can it just affect your body, but it can affect you mentally as well, because we do know there are addictions that can happen. So I think what Tom Holland's doing is quite amazing.
Yeah. Again, normalizing the conversation and the fact that alcohol is really damaging. They're saying alcohol is the new smoking. So we really need to raise awareness about the fact that, yes, a lot of people do it socially. It is legal. That doesn't mean it's healthy, right?
No, I completely agree, and I think this is that maybe we have a conversation about this with a gentleman on her podcast about alcoholism and drinking in the new age of maybe not drinking. But I think, again, it's starting that conversation and normalizing the fact that, when you go outside to have, to meet your friends, that you don't necessarily have to have a drink. And I'll have to be honest, I'm probably not the best person out there to drink. I'm not a big social drinker at all. And yeah, I like my martinis. It's fine. My sugary drinks.
So another one, actually, this is the last one, which was really surprising to me. And I don't know why it was surprising, but men are twice as likely as women to develop skin cancer, including melanoma. And, I think it's kind of ties into this last one, which is reluctance to use sunscreen. So a survey showed that only 14% of men use sunscreen regularly, even though they're at greater risk of skin cancer compared to women.
I'm looking at you, Jordan, if you're watching the podcast.
Oh, really? Jordan?
Yeah, he didn't want to wear sunscreen.
Oh my gosh.
There's zinc, there's this kind of stuff. There's toxins. I'm like, listen, man.
There's like mineral sunscreen now.
Oh, yeah. So, yes. So I did purchase mineral sunscreen, which was a little bit more expensive. But at the end of the day, I was able to slather on and make him wear sunscreen.
My dad, my whole entire childhood, never wore sunscreen, still doesn't. He puts on like tanning oil. Like, isn't that the opposite of sunscreen?
That's the opposite.
I know. And like, he's like, oh, well, like back in the 70s, the sun wasn't as harsh. I'm like, okay, but it's 2024 now. It is not the 70s and the sun is stronger.
Yeah, the sun. Well, I mean,
I feel like, and he's older too.
Even in overcast weather, the sun can actually still peek through, and it's just important. Anyways,
yeah,
wear your sunscreen. It's fine. So let's talk a little bit about some of the stories that we want to talk today. I'll talk a little bit about a heavier one first, and we can move into some more funny stories in relation to, men's health.
All right.
So the first story I want to tell you is about a friend that I had a long time ago. Unfortunately, I don't want to say we lost contact, but we lost more communicative touch because I was more friends with his wife. This is when we lived out far in Shelburne, and he became a police officer. We moved away, and I think you kind of keep contact and touch base with people through Facebook. So this was kind of through Facebook that I actually saw that this individual was sick and I didn't even know. And I was like, oh, damn, it was quite surprising. And then I think a few weeks later, I checked and he had passed away.
Oh, no.
And I believe he was diagnosed with prostate cancer, like when he was 39 and like died, or either 39 or 40 and died at like 40, 41. So still like a really young guy and passing away from prostate cancer. And I think it's just, I was pretty devastated. I was pretty shocked. I couldn't believe it because it's just, he's healthy.
He's young.
He was Black. And it just, I don't know, it just wasn't on my radar. And again, I think the other one that wasn't on a lot of people's radar was Chadwick Boseman from Black Panther.
That was really upsetting.
And the thing is, like, technically he had prostate cancer while he was filming Black Panther, just dealing with it very silently.
And he didn't tell anybody.
And then, of course, he passed away. And I think that kind of, I would have hoped, I think it did generate some conversation, but I think the conversation needs to continue to be had. Like I was hoping that we'd see more campaigning around, men's health related to prostate cancer, seeing so many young folks, particularly Black males too, passing away from something that could be quite preventable if checked. So again, maybe that's something that should be standardized. Maybe we should be doing PSAs at 40 or even younger. I guess again, if we're seeing, I guess that's that health equity piece. If we're seeing certain populations that it's more aggressive in, or we're seeing it happen at a younger age, maybe we need to set a standard and say, hey, if you have history or, you're of this ethnicity or race, that you actually do get your prostate checked sooner and your PSA checked as well.
Yeah, I think that's really important. And I think as long as we keep having these conversations and advocating, right? Like it's something that I feel like, people might think, oh, it's an added cost. But if you think about how many people you screen in order to diagnose someone or to save a life, it's probably cost effective, if not. And I think it's really important.
And I'm sure if a male campaigned on it, it would happen very quickly. Anyhow.
Okay. So I have another story. I'm only going to briefly touch on it because I don't want to start crying. But one of our really good friends actually passed away from alcoholism 2 years ago. And it was really bad. Like when I found out how bad it was afterwards, like he had been suffering, he'd been having trouble with alcohol for years. Like he'd gotten DUIs, he'd gone to jail. Wow. He went to rehab twice. And it was so bad that this is so honestly, I was so upset when I heard this, but he couldn't stop drinking in rehab. Like he actually drank hand sanitizer. Like that's how bad it was. Oh. And at one point he started getting tremors. Like he was having neurological issues because of how much he was drinking. Like he was malnourished because all his alcohol intake were basically all the calories he was getting. And I think that we need to have more conversations about alcoholism and how they affect people. Yeah, he was fun when it was good, but kind of things took a sour turn and he actually passed away a couple years ago. And the really sad thing is we didn't even know for a year because he had not been in touch with anyone. He kind of was just off the grid. And we were always thinking, oh, he'll resurface because that's what he always did. Right. But then we found his obituary online and I'm like, oh my God, this actually happened. Yeah. But I think that just normalizing these conversations and talking about the fact that it's okay to ask for help. And if you feel like someone in your life is struggling, if you haven't heard from them in a while, just check in on them or, go make a visit in person. I kind of wish we'd done that or we'd asked someone to do that. But unfortunately he lost his life and I just want to continue to honor his memory by talking about what we can do to help people struggling with substance abuse. Attention hospital employees and retirees in Canada. Picture this, a benefit plan designed for casual and part-time hospital employees and retirees who aren't covered by their hospital's group health plan. Introducing Healthcare Providers Group Insurance Plan.
a friendly partner dedicated to your health and well-being.
With affordable plan premiums and an exceptional support team, Healthcare Providers, also known as HCP, is dedicated to helping you every step of the way. Enrolling is easy, and you'll have access to a wide range of health and basic dental benefits from day one.
Already have health and dental coverage through another group plan? HCP still has your back. For less than $32 a month, the Signature Package, which includes life, long-term disability, accidental death, disease, and dismemberment, provides valuable income protection and peace of mind for the unexpected.
So take charge of your healthcare and financial security today. Visit healthcareproviders.ca to learn more.
Thanks for sharing that story. I think this is where it's so important for us to not demonize folks who are, struggling with addiction, whether it's alcohol or any other form of, substance, whether it's, morphine, whether it's, other more potent forms of drugs. I think at the end of the day, addiction is such a bitch. It's such a difficult thing that people struggle with. This is where we need to talk about like societal expectations and how society perceives folks with addictions, and knowing that we know these people need a lot of support. They need mental health support. Some of these folks become unhoused because of their addictions. And the fact that we have like premiers and governments that are continuing to demonize people like this really just gets under my skin. So it's, I think, as much as we're here telling these stories, I think it's everybody's job to advocate for folks who are struggling in this way. And I know, for example, in my own family, I have a family member who struggles with addiction and had stayed with us for some time. And I thought about, kind of the story of what happened with him here and how difficult that was. We did have to set some boundaries, because I do believe that's the other piece. Sometimes folks who are struggling, you do still have to set some boundaries in terms of how you might interact with them and how you can care for them, even if you're caring for them for a distance. But at the end of the day, knowing that, at the end of the day, I still love and care for this person. And I want the best for them. And I think at the end of the day, we just need to continue to have the conversation. We need governments that care as well. And
addiction, it looks all different ways. It's not like one certain type of person, right? So I think we need to not stereotype people, not judge people, and be there for them, because when they're ready to get help, they'll know that you're there.
100%. Yeah. And again, I think there's that saying, it's like, you can only lead a horse to water. You can't force them to drink. But again, if we put all those things societally in place, whether it's, looking at the social determinants of health, whether it's giving those basic need necessities. So like having housing, having access to, those social supports, getting folks who need jobs, like all of those different things, that we can actually turn some of these crises that we're seeing around. Very heavy stuff, but important stuff to talk about. So maybe we should dive into how our husbands deal with their health.
Okay. Well, like we say, we're always on as nurses. We don't ever get to hang up our stethoscope. If you listen to our previous episode, we talked about all our debacles on our respective vacations. But now let's talk about, for me, what it's like to live with someone who's extremely accident prone. It's like, I think I knew what I was getting into when I first met my husband, because he'd mentioned all kinds of random things he had in the past. So in high school, he messed up his knee. So he had knee surgery. He had like a pilonidal cyst, which if you don't know what that is, it's like basically an abscess on your tailbone.
Right.
And the thing is, like, just all these random things go wrong all the time. He had his appendix out like twice.
What?
Yeah, I know. It's really random. He also got hit by a truck when he was a teenager and like almost lost his leg, and they had to stitch it back up. They said he'd never walk again. But then I guess like once we started dating, let me just tell you, we went on a trip to Alberta. So we live in Ontario. We went on a trip to Alberta to visit someone. On the first day, does he not like, he's playing like frisbee in the park with our friends. Okay. Does he not step into like a ditch and like mess up his knee?
Oh my God.
So badly. He's like, he had to hobble out of the park. And meanwhile, it's like me and my friend, he's got an arm on each one of our shoulders. He's like hobbling. I found out that visit that if you have OHIP, which is our insurance on Ontario, it is recognized in Alberta. So luckily we didn't have to pay for anything. It was just it was kind of messed up. So like he messed up his knee. We later found out it was an ACL tear and also a partial meniscus tear. So for the rest of that vacation, he was on crutches. We went to the Calgary Stampede on crutches. I was like, we're not slowing down. I'm like, we're still going to do everything because this was the first day. Okay.
It's like, this is your fault for stepping in that ditch.
Right. And it was like, I was like, we're not going home. I mean, it was the first day. And like, they basically were like, okay, you're kind of like on painkillers and you're going to be on crutches until you can get home and get on the wait list for surgery. Right.
Wow,
so there was really nothing to be done. I'm like, well, I don't know why we should go back at this point. So we just kind of forged ahead. And we even rented a car. And because I think at the time I was under 25, it's cheaper to rent a car if you're over 25. So he still drove with his knee the way it was. I don't know how we did it.
Well, what leg was it? What leg was affected? Don't tell me is right.
No, I think it was the left.
Okay. Phew.
I'm terrible, but I think it was the left, not the one that you used for gas and braking.
Okay.
But yeah, it was kind of crazy. And then when we got back, so we got back and then he had to like get referred to a sports medicine doctor and they put him on the wait list for surgery. But meanwhile, he had to get an MRI. And you know how MRIs run 24 hours, right? So he got a letter in the mail and it was like, you're booked for an MRI at 2 a.m. at this hospital. But there must have been something lost in translation because it said, instead of a knee MRI, it said a bilateral breast MRI. And it was supposed to be at Women's College Hospital.
Oh no.
So I'm like, is he turning into a woman? Like, what's going on? So anyway, we got that sorted out. And like when he called, the person laughed. I'm like, oh, I think they meant knee. But how is knee similar to breast MRI? I don't know. But like ongoing knee issues. So sometimes when I think of all these knee issues, I think of you, Amie, and all your knee issues. I know it's not quite the same, but I was just thinking like, and the thing is like when we went for the surgery, I was helping him fill out all his pre-op paperwork.
Right.
So, you know, on the pre-op paperwork, it asks you to list health conditions and previous surgeries. So I actually had to write, please turn over. I'm filling out this paper form and I'm listing all the surgeries and I'm like, please turn over. And then it was like all the ones I told you, plus a couple more. And they're like, this is a lot. I'm like, I know.
Your husband sounds like Mr. Glass. Have you seen it?
But he's actually like, but he's actually like pretty strong. Like he can do a lot around the house. I think he just like breaks down a lot. So we kind of joke sometimes that he's like Wolverine because he can do stuff, right? But then he breaks down a lot, but then he gets like, he heals like pretty fast. So he's always like cutting himself. And he's like, oh, 2 days later, my cut's all better.
That's like a Jordan thing. Cut. Look. I'm like, oh my God, you almost lost your finger. Oh, that's crazy.
I know.
You read that accident prone stat related to death. He needs to take care of himself.
I know. But it's like, he's also one of those people that won't go to the doctor until it's like dire, and I can't seem to do anything about that.
Jeez. Well, I mean, that's wild. All those different things that have happened with your husband. So
that's just one of them. I want you to tell some of your stories now. I don't want to take over the whole hour.
Well, yeah. I mean, when I think about my husband, he's definitely he's accident prone. I don't know if he's that bad, but he definitely does like cut himself all the time. He doesn't care. I think his hands, he doesn't seem to really care where they end up. So like
that sounded bad.
Anyways, multiple burns. So like he'll be like, oh look, I have a burn on my forearm. I'm like, how did you get that? He like reached into the oven and like burnt his hand. I'm like, aren't you wearing like hot mitts? No. So he's like all these like burns. I'm like, this is crazy, and all these cuts on his hands. But I really want to talk about what happened when we went to the Caribbean.
Yes,
because I think the other pieces, men don't listen. And maybe I'm wrong, but I know I'm not. They really don't listen to sometimes some of the advice that we give them. And we had just come back from Montego Bay. So we were at the Toronto Pearson Airport, and you know how when you check your bags, they have to come up onto that carousel thing.
Mm-hmm.
So we had a checked bag. It was coming up on the carousel. I saw it was like wedged in between two other bags, and there was like a bag on top. And so I went over and I gave it a good tug, and I'm like, damn, this bag is heavy. It's stuck. And I knew it would not budge. So my son went over, one of my older sons went over, and he gave it a try, and he's yanking on it and shaking as he's trying to pull it off the thing. And I'm like, Logan, leave it. It is absolutely stuck. You cannot pull it off the corral. My husband I see him hearing over it. I'm like, Like,
let me, I can do it.
I'm a man. And I'm like, oh yeah, here we go. So I'm like, Jordan, it's really stuck in there. And all I hear is, oh, do I turn over to see him like sitting like on the floor or like clasping his bicep? I'm just like, what happened? He's like, something, it's torn, it's off the bone. I'm just like,
Off the bone.
I'm just like, what the hell is happening? I'm like, I told you not to pick that thing up. So long story short, he ends up tearing, like full tear of his bicep. Had to have surgery. And here I am, you know, with 4 kids, all the bags, everything just having to manage because he did not listen to me to tell him that it was stuck.
Right. So just for my side of the story. So I asked Jordan actually what happened before you told me.
What?
And he neglected to mention the fact that you told him not to pick it up. And he also neglected to mention, because you told me like the first time you mentioned the story, you said he reached over one of your sons, right?
Yeah.
He also didn't mention that. So not proper ergonomics either. And he's like, yeah, I just like, I pulled it and it wouldn't come out and I tore my bicep. So that's all he told me. He didn't say that you told him not to do that. He didn't say how heavy it was. He also didn't mention like how tightly it was wedged in between these other 2 luggages.
Of course not. I mean, you know, hero.
So in hindsight, probably he should have waited till the other 2 people got their luggage, right?
100%.
And so that he could lift it up.
Just let it go around.
So what ended up happening? Like he couldn't get it, right?
Yeah. So it actually got worse. So I remember, so he's sitting there, I'm trying to corral all my kids like cats. They're going in different directions. I'm like, don't go anywhere. Let's try to figure this out. And actually one of the WestJet attendants, I was like, hey, could you call an ambulance for my husband? And this woman who was just like, what's the number? I'm like, for an ambulance, like 911, like. And she's like, oh, she's looking super confused. I was like, okay, don't bother. You can't help me.
Clearly this has not happened before to her.
She asked me what's the number for an ambulance. She's wearing a WestJet outfit. Like
she doesn't know the number.
She asked me what the number was. I'm like 911. She seems so confused. Anyhow, another WestJet attendant came over, helped us get our bags on, and kind of pushed us out till we got to, you know, those cones where I was picked up by our father-in-law, and I chugged everything into the back of the car, and he ended up heading over to Brampton Civic Hospital.
So you had to drive them, right? Because he couldn't drive with his torn bicep.
Well, he wasn't even with me. He went off to the hospital. I had to leave and do everything by myself. It was a nightmare.
But he got the surgery. He's on his way to recovery now. Yep. And what have we learned from all of this?
That they should listen to women.
I was going to say 4 words. Listen to your wife.
Yes.
That's 100%. That's what the lesson is here.
Yes. And I mean, at the end of the day, I think that they should listen to their own bodies. Like, I mean, this is where I think we're pretty good and we're really in tune with what's happening with us. So, you know, if an extra lump or bump or something happens with us, we tend to be kind of like, oh yeah, this feels not right. But men just sometimes just don't listen to their bodies. And I think it's so important that that's a skill that they need to learn as well. So listen to your bodies.
Right. So just along the vein about sunscreen, right? Oh. So I'm thinking as you're talking, like my husband is really fair. Okay. So I feel like at this point in life, he should know, like he needs to be covered up at all times. Like, or he needs to like slather on sunscreen regularly. So and again, we were away in Cuba. So we were away in Cuba and this was on the last day. So on the very last day, we had like checked out of our room, we stored our luggage at the front desk, and then we went to the beach because we're like, we have a few hours until we have to get to the airport. And I was like, do you have sunscreen on? And he's like, no, it's in the bag. I'm like, do you want to get it? Because like we still have a few hours. He's like, oh no, it'll be fine. I have like my hoodie on. So we were just like, we went down to the beach and then we were just like laying on the chairs and he fell asleep. To be fair, I mean, he was wearing a hoodie. It was pulled up. Like the only thing showing was his face. Okay. Like everything's covered. So like when he wakes up, I was like, oh, I'm like, you're looking really red. Are you okay? And he was like, he's like, my face. He's like, it hurts. It hurts to move. It hurts to talk. And like, honestly, he was so red, like complete strangers were coming up to him being like, damn, are you okay? It was like that bad. And then we had to go get the aloe from the store at the hotel. And he like slathered it on and his skin absorbed like half the bottle.
Like it was that bad. But like, have you ever been so sunburned that strangers are coming up to you asking if you're okay?
He sounds like he'd be as. Have you seen Inside Out 2?
Yes.
You know the
anger?
No, not anger. The embarrassment.
Oh, yes. Yeah, it's pretty much like that.
Oh my God.
Yeah, it was so bad. And like, I guess like one of the things is he's like, I don't like to wear sunscreen because I sweat a lot and it drips into my eyes. So then I went and bought this like, it's almost like a stick of deodorant, but it's like a sunscreen stick. Right. I'm like, just use the sunscreen stick or like wear a hat or whatever. But I'm constantly having to like remind him. And I'm like, I think you should just prioritize your skin and your health. But
well, again, we talked about the skin cancer stats. Again, it's important. Another thing that men should be kind of conscious and aware of. So yeah, like, I mean, what if you weren't there? You just burn up and turn to a chip?
I don't know. A lobster.
Yeah. I mean, I think at the end of the day, like I think about some of the other things related that, like, you know, the man colds and things that like our husbands tend to get, where it's just at the end of the day, really what we're trying to say is to take care of yourself, take care of your own health, make sure that, you know, you do those tests, that you get your PSA checked, that if you have a lump or a bump, that you look into it, and that you don't really delay, right? And I think, again, you mentioned heart disease and talk about hypertension being the silent killer. I would recommend that, you know, every once in a while, you know, if you're at Shoppers Drug Mart, get your blood pressure checked, right? Or whatever the case may be. And yeah, if you're sitting in those ranges of the 150s over 90s, that's a problem. So I would definitely bring that up with your doctor and say, hey, you know, although I'm feeling fine, my blood pressure has been sitting around here, because that's another one that we need to make sure that we're looking out for.
Yeah. And as you know, on the podcast, we're always about like, what can you do? What are some tangible steps you can take? So like, how can we as women encourage and advocate men to take care of their health? So one is encouraging regular checkups and specific health screenings. Like we mentioned, the prostate exams, cholesterol checks, blood pressure monitoring. One simple thing you can do actually is like buy your own blood pressure cuff. If you don't want to go into the doctor, like take your own blood pressure and kind of keep track yourself to make sure it's in a healthy range. And if it's not, then you can bring your concerns to your doctor. You can also just start having conversations. Like, I think once you break that barrier, it becomes easier to have these conversations with people. Another one would just be kind of promoting healthy lifestyles. You know, surround yourself with the kind of people that you want to be like. So if you want to get healthier, if you want to exercise, maybe just find people around you that are already kind of doing those things. Use platforms for advocacy and share your personal stories. So I think like if you share your struggles or, you know, what's worked for you, that might kind of encourage someone else in your life to do the same thing.
Yeah, I know for men, and because of these different stereotypes, that talking about their bodies are probably not the first conversations that they're having with folks. But I'd like to challenge all you know, folks out there today that for the month of November, have one conversation about prostate cancer. Even if you use talking about Chadwick Boseman or a story that we've mentioned, or even your own story, just make sure that you you know, talk about prostate cancer, making sure that you get your prostate checked. Again, like I say, you know, I say to our fellow ladies or folks who have chests to get your boobies checked. Now I'm saying get your booty checked.
Yes. And have a conversation about mental health, because I think that's huge. Like, I know a lot of men that are struggling with panic attacks, with anxiety, depression. It's not just something that women suffer from. I just think men don't talk about it enough.
Yeah, we're gonna continue trying to break down myths here at the Green Nurse Podcast. Again, thank you so much for listening. Like we said, it's the month of Movember. Here's my mustache. I know it could not be serious enough with having this thing on, but make sure, like I said, get your prostate checked. Let's continue having the conversation about mental health, and, you know, try not to you know, break down before December, because we need you here. We need you strong, and we need you to make sure you look after yourself.
Right. And if you like what you hear, don't forget to subscribe, leave us a review. We always want to hear what you have to say. If you have any feedback or an idea for an episode, let us know.
Absolutely. Thank you so much for listening. Take care now.
Thank you for listening to the Gritty Nurse Podcast. If you have any suggestions or want to hear a specific topic, email us at grittynurses@gmail.com. That's grittynurses@gmail.com.
We are also speakers and authors available for engagements related to advocacy, nursing, mental health, and health policy. Please connect with us.
We want to take a moment to express our deepest gratitude to our incredible sponsors. Their generous support has been instrumental in making our podcast a reality.
Thanks to their belief in our mission, we're able to bring you engaging content and connect with our amazing community. We're truly grateful for your partnership. Thank you.